everybody. It's Dr. Wilson, the Wilson Clinic. What I wanted to talk about today was in regards to vitamin D. I've had a lot of questions recently, practice members asking, well, how much vitamin D should I be taking? Because we're seeing more and more people are catching on and learning how important vitamin D is to our overall health. And so they're starting to know, hey, this is a really vital nutrient. Let's get on board and really keep our vitamin D in check and up where it should be. But they're constantly asking, well, how much should I take? And really the honest truth is, I don't know unless I know where your vitamin D level is at. And that's the reason why we do blood work, to check on what the vitamin D level is for somebody. Because if we can determine where your vitamin D level is via blood work, then we know what the appropriate dosage would be for you to take to be elevating your levels up to where they should be. So it does make a difference. If your vitamin D is at a 15, you're going to take a whole lot more vitamin D on a routine basis to get that to an appropriate level than if your number was in the 45, 50 range. You're not going to need nearly as much on a daily regimen. So if you want to know, without guessing, how much vitamin D you should be taking, make sure us or whoever your provider is, make sure that they're doing the blood work, measuring the vitamin D, find out where your level's at, and then you can make that appropriate determination as to how much you should be taking. And then, of course, down the road, you can recheck on that and making sure that it is going up. That's a second point that a lot of people are missing. They'll have their vitamin D checked. They'll take a supplement based on that lab test, but then that lab test becomes 6 months, 12 months, 2 years, 3 years old, and they're still taking the same amount of vitamin D that they always have. Well, that amount can and should change over time, because if your vitamin D supplement is worth its weight and is a quality thing, your levels of vitamin D in the blood should be able to go up, 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 up. If it's not, then you need to switch what kind of vitamin D you're taking and get on board with something quality, something good. So make sure that you're following up down the road, rechecking via blood work, finding out, is your vitamin D level going up like it should, and getting into that appropriate safe range. So if you have any further questions on that, if you're part of the practice, come to me anytime, of course. Otherwise, check with your provider. But that is an important aspect to know in regards to your vitamin D. Have a great day.